progress in the fight against HIV AIDS in southern and eastern Africa is being threatened as HIV infections remain high for key populations. Women and girls remain disproportionately affected, accounting for 63% of new infections in 2021. For more, let's get into the results of the In Danger study. It's part of the UNAIDS Global AIDS update for 2022 with Director for the UNAIDS Regional Support Team for Eastern and Southern Africa, and Shongwe. And good evening to you and welcome. We've been so focused on the COVID pandemic and monkeypox that we must remember that a battle is still being fought against HIV AIDS. This study, what does it tell us about why regional progress seems to be faltering?
Thank you so much, Imani, and it's wonderful to be here. Great to see you again, my dear. Well, let me just say that, first of all, we've been living with AIDS. We've had AIDS with us for 40 years. This report is a report that we release every single year. And what it's telling us is that before COVID, we had made significant progress. We were beginning to feel that we truly are turning the corner on this pandemic. And that our goal to end AIDS by 2030 is possible. But what we have seen is a clawing back, that because of COVID, the Ukraine war and redirection of resources, that we are beginning to see some very worrying trends across the world. So HIV infections have been rising across Eastern Europe, across parts of Asia and Europe, Western Europe in general, and really concerned about that. Now, in East and Southern Africa, where we are the home to the largest number of people living with HIV, 54% of the people across the world who have HIV live in our region, we had seen substantial progress. But what we are seeing is a slowing down of the number of the decline. So we were seeing a drop in new infections at about 8 to 9% over the past years. That has slowed down in the last couple of years. And the reason that we're seeing this faltering is a couple of things. We're seeing them in particular population groups. So what we're seeing is women and girls, as you mentioned, are by far the largest group that are impacted. And Iman, the stories, we've been on this conversation before about violence against women and girls. It's a big issue. It continues. Girls are in very risky sexual relationships, transactional relationships. Between the ages of 15 and 19, 6 out of 7 new infections are amongst girls. And I dare say that those infections are even below 15. You recall during COVID, we reported a spike and surge in teenage pregnancy across the region in the safety of their homes. And so this is one of the big areas of concern, that we have such high numbers amongst adolescent girls and young women in general, even women your age, my age, and older are also experiencing high levels of infection. So it's the unequal power relations between men and women in terms of sexual relations. But we also see this amongst key populations. The key populations we define as gay men and men who have sex with men, sex workers and their clients, who are very risky. I mean, they've got really high levels of infections amongst these groups. Transgender women, people who inject drugs, prisoners, those who are in concentrated communities where the infection rates are skyrocketed through the roofs. In some areas, 40 to 50 to 60%. Yeah. So, this is where we see really, really high infections.
Very, very worrying. And thank you for sharing just a deeper and more complex picture on what makes these particular groups uniquely at risk. But what about the unique risks depending on whether you are in an urban or rural setting, Anne?
So this is very, very important question, Imani. It's for sure, we see that urban areas have much higher concentration of higher risks. And, a lot of these adolescent girls I'm talking about, the communities, the key population communities are urban-based. And this is where income poverty, because people don't have access to jobs, they don't have access to food that they may have had in their rural areas, and are therefore involved in very, very risky transactional relations where they don't have proper protection. The adherence to drugs for those who are living with HIV, goes down. During COVID, of course, in the initial phases, we saw that a lot of communities were not able to access their drugs. On the positive side, further on in the COVID pandemic, we were able to see health workers in multiple countries being able to actually provide multi-month dispensing of drugs. So we've seen some pros and cons about being urban versus rural, but we certainly are seeing where you've got high concentration of these particular vulnerable communities that this continues. So in this Women's Month in South Africa, this is something that we're very concerned about, the kind of violence, the continuous transactional and not formal sex work, but risky transactional relations that young girls are engaged with. What some people call the blesser culture, or what others call sugar daddy culture. This has continued, and it doesn't have to be much older, but if you see 6 out of 7 girls being infected between 15 and 19, that's alarming. The other thing that we're seeing as an important trend, and again, this is happening also much more in urban areas than rural areas, is girls getting infected and transmitting infections to their babies. So we have 77,000 children in our region who've been born to HIV at a time when we should be turning the corner. Botswana is showing us signs that they're on the path to elimination. They've got what we call silver status of the path to elimination. So they're giving us hope. But many other countries are showing us that, infections are continuing through breastfeeding, through birth. And this is a worrying trend because it's mostly teenage girls. It's mostly the younger girls who are giving birth to children with HIV. And
it's such a concerning picture that you raise. We've spoken about these various syndromes. I mean, we call them sugar daddy syndromes in certain communities, the disproportionate exertion of power, and the taking away of sexual agency from young girls in that transactional way that you mentioned. But of course, we can't expect minors to make decisions that adults should be making. So where are the people to stand in the gap for those vulnerable and exposed communities? I suppose that's also a question for another day. You touched at the beginning and on the impact of the war in the Ukraine and the effects that it's had on the world, impacting funding for programs related to HIV and AIDS. Maybe just a quick word on how concerning that is.
This is really concerning for us. We have seen some of our bilateral governments, these are governments in Europe in particular, in the UK, in US, who have actually reduced their investment in HIV down to by 75%. I mean, this is significant. I don't know if you know this, but across most of our countries in East and Southern Africa, across Africa, our treatment programs are funded up to 90% by our partners, whether it's the Global Fund. The US government is a significant funder, but we also have funding from the UK, from Ireland, from different partners. And what we have seen is that some of these governments have clawed back their resources because they need to redirect them towards refugees coming in from Ukraine. We also, of course, are concerned about food supplies from Ukraine. So this is it's a really big concern that when we are pushing to end AIDS, that we then turn our attention either to new pandemics or this crisis in Ukraine is redirecting the resources that should have been placed to enable us to push to the end of AIDS. So it is of deep concern for us, and we are working very hard. And recently we had a webinar with the press, and in that webinar we spoke to, we were sharing how some of our governments, like Kenya, have been working on a new development impact bond that is trying to find resources that would put money from domestic resources, from the capital markets, into programs that are linked to ending AIDS and to teenage girls and sexual and reproductive health and rights, because that's a big issue for.
We've certainly got to get it back. We've got to get it back on track, and if we are, going to reach this objective of ending AIDS and HIV by the year 2030. Thank you very much for sharing with us, albeit a grim picture on where we are. And I understand for people who want to find out more, there is some developments and some good news, perhaps a little good news on the pediatric front with regard to HIV. So that was Anne Gituku Shongwe talking to us about this new report into HIV and AIDS.